want to thank all of you on behalf of the CHQI board, who I will introduce in a moment, and UC Health, which many of you in this room are affiliated with, and we thank you for your commitment to UC Health. So thank you for spending one of your very busy days with us here in Oakland. Without further ado, I would like to introduce Dr. John Stobo. He is the SVP for Health Sciences and Services. He is responsible for strategy and policy for the medical centers and all of the health profession schools. He'll speak to you for a few moments. Thank you.
Well, thank you very much. And speaking of thanks, how about a hand for Terry, who actually put this together. Terry? Well, I want to welcome you all here and thank you for participating in this colloquium. My job this morning is just to give you a little background on how we got here and what's going on in what we call UC Health, what UC Health is all about. It was in February of 2010 that we had a group of individuals from throughout the University of California who were interested in issues related to quality, cost, etc., safety in the clinical enterprise, come to a meeting down in Jack London Square to present the work they were doing in those areas. And it was a terrific meeting. You would have had to go to 10 separate meetings throughout the country to hear what we heard in one place that day. It was so impressive that we felt that we should do this on a regular basis, that is, to have a coming together of people who are interested in like issues related to the clinical enterprise, and also that we should do something system-wide to support efforts in those areas, particularly efforts that maybe were going on at one campus or two campuses, but then could be extended throughout the clinical enterprise associated with the University of California. And that gave birth to the idea of a Center for Health Quality and Innovation. Terry is the executive director of that. As she indicated, the board consists of the CEOs of the medical centers and the deans of the schools of medicine. And all of you have been touched by the center in one way or another. It has, in my view, been very successful in terms of sending a message that we think work in these areas is very important to the University of California. And I think we've seen some very important fruits of the research and other activities that have been supported by the center. UC Health is actually a virtual organization that includes all the clinical activities associated with the University of California. And that includes 16 health professional schools and 5 medical centers that are located on 7 of the University of California's 10 campuses. It's only Santa Cruz, Santa Barbara, and Merced that at this point don't have a health professional school or a medical center. If you look at the educational activities that we're involved in, we are the largest training program in the United States if you take the aggregate amount of training that we do in all our health professional schools. In terms of physicians, 60% of the physicians who practice in the state of California have received their education at one of the University of California medical centers or schools, and 40% of the residents who train in the state have had their training at the University of California. In terms of clinical services, we are the 3rd largest provider of overall clinical services in the state. And in terms of the very complicated procedures referred to as tertiary, quaternary, we are number 1 in the state of California. That is roughly 22% of the high-end complicated procedures that are done in the state of California are done at a University of California facility. I think it's fair to say that our health professional schools, in terms of research and education, rank among the best in the country. Schools of nursing, optometry, dentistry, pharmacy, medicine, et cetera, are ranked 1 or 2, or certainly in the top tier in the country. If you look at the way people keep score and say, well, how do our medical schools do in competing in terms of research? All 5 of our medical schools are in the top 50 out of 130 medical schools in the country. 3 are in the top 15, and 1 is number 1. So I think we take great pride in the fact that we have in UC Health a research and educational enterprise that is without peer in terms of the quality, the depth and breadth of the activities that go on in those two areas. Now, I don't have to remind you that the missions of academic health centers in UC Health are actually three. It's research, education, and clinical services. And I think it's fair to say that we rank these not vertically but horizontally. That is, each is equally important, and they're all inextricably linked. We can't do the type of research we do without having an associated clinical enterprise. We can't do education in health and in illness unless we have a clinical enterprise and a research enterprise that's top-notch. But I would submit that while we're very proud of our research and educational enterprise, and rightfully so, and while we look at how they rank nationally, they are without peers, that we don't do so well in terms of our clinical services. And if we're true to what we say, that is, each of these are equally important, then I think we need to pay more attention to what goes on in the clinical enterprise. And if you simply say, how does the best of the best stack up in its clinical mission with regard to these 4 points, affordability, quality outcomes, patient experience, population management, I think there's room for improvement. If we look at affordability, we are not the most affordable in the state. If you go from market to market, we're either number 1 or number 2 in terms of the prices we charge for the services that we provide. So I think we've got a long way to go in terms of being affordable. If you look at quality and outcomes, while we're good, we're not the best. We don't rank as high in our quality outcomes as we rank in our NIH research. And we have good data to show this, so we need to improve on our quality. If you look at our patient experience, and there is a scoring called the HCAHPS, which is Hospital Consumer Assessment, Physicians and Health Plans, which asks things: does your doctor listen to you? Does your nurse listen to you? Is the hospital quiet? Would you recommend the hospital to somebody else? We rank between the 50th and 70th percentile. We're not the 90th percentile in the country, or we're not number 1. In population management, while there are a lot of good activities going on in our campuses, I think we can improve in that area also. So the point I want to make is that we have a tripartite mission. We're extremely proud and keep very close track of how we perform nationally in the research and educational components of our tripartite mission. We need to pay the same attention to how we rank and how we perform in our clinical mission, because this is becoming critically more important to us in the era of healthcare reform, et cetera. So the clinical enterprise, we need a clinical enterprise that is as good as our research and educational enterprise. And I think today you'll hear several presentations which will allow us a mechanism and a means to make sure that that happens. So I want to thank you all for being here. Thank you for your support and interest in UC Health, and look forward to a great day. Thanks.